Now I'm gonna do a little bit of a pin and stretch on your muscles, meaning I'm kind of moving you around through your range of motion. As I indicated before, a lot of lower back pain originates in the hip area, especially in these glutes. So I'm gonna kind of be getting in those a little bit to loosen everything up, make sure that we're kind of targeting every aspect of your pain, okay? So I'm gonna use your leg to help me, and we're just gonna be doing this motion like this. So moving you around through your range of motion. So I'm gonna use my elbow to kind of get a couple of the trigger points in through your glutes here. Does that feel tolerable for you?
Yeah.
Okay. So in this technique, we can also target a bunch of the different pelvic muscles, including the piriformis, which is a major indicator in sciatic symptoms in patients, because the sciatic nerve often comes out in between fibers of that muscle. So when the muscle becomes irritated, which can happen with repetitive sitting, especially lifting, bending, things like that, it will start to impinge on the sciatic nerve and cause a lot of leg symptoms. So by doing a little pin and stretch of this muscle right into the middle of the hip here, we can loosen that up and help to alleviate some of the sciatic symptoms that people often experience, especially with sitting long periods. So with sciatica, we definitely recommend sitting on softer surfaces, no hard kitchen chairs, bleachers for sporting events, things like that. You also want to try to avoid bucket seats, so Adirondack chairs, low sports cars, things like that. So bucket seats are not great for pelvic alignment because you always want to try to be in a situation where your knees are able to drop below your hips as opposed to coming up past your hips like they would in an Adirondack chair. It puts a lot of strain into the hip flexor region, which correlates with lower back pain, as well as kind of rocks the pelvis back into an improper ergonomic position that will put a lot of strain on some of the other surrounding musculature and joints. This technique is also really beneficial for people that experience lateral leg symptoms, which goes down the outside. People will often complain of calf pain or outer knee pain, which tends to originate in the glutes. So this is a good method to try to loosen up some of those outer glute trigger points in order to alleviate some of those pains.